Hello YouTube, what's up? My name is Ellie. I'm a non-binary trans guy. I've been on testosterone for 3 years and 11 months. In the beginning I was on very low dose testosterone, which is I think why a lot of people ended up watching my channel, because it's one of the only channels that talk about that. And I'm in the process of getting top surgery, which for those of you who don't know or are new to the jargon, what it means is having the breasts that I was born with removed. Really happy and excited about it. I've been wanting it for a very long time, and I have already been to see several surgeons. Actually, I even have a date for surgery with one of them, but because I had already scheduled another appointment with a different surgeon, I went to that as well. So that was yesterday, and I want to talk about that. So the surgeon that I have a surgery date with is Tintoret Braço Clinic here in Barcelona, and they're gonna charge 6,000 euros 500 to do a double mastectomy with 3 nipple grafts, and that is the surgery that I want to get. And now I'm going to talk about the second doctor that I went to see. So speaking to trans guys over here, I've heard the name of Dr. Moscatiello thrown around quite a couple of times. He's an Italian surgeon. He works here in Barcelona as well, and he's actually cheaper. He's actually cheaper than the other guys, substantially so. I think about 1,000 or 1,200 euros cheaper than the other guys. And I have seen results of him online, and I was kind of like divided in my opinion, because some of the results that he has are really good, and some of them have really cup-shaped scars. And going into this, the one thing that I know is that I really want to have like straight line scars, as little curvature as possible, because I really hate it when the scars after top surgery, the double mastectomy, kind of looks like a cup of a bra or an actual breast. So going into this, I was kind of like from the get-go, because I didn't know, and went into the clinic. They were very nice. Of course, correct language everywhere. They're always treating you like a guy, like all the other surgeons that I've been to, except maybe like this one Israeli guy who was like kind of like gatekeepy about stuff. But really, treatment was absolutely fine. Dr. Moscatello, he's Moscatelli. God, I should really know that guy's name. Anyway, he's a very nice man, very professional. Explained the procedure to me, examined me, and told me that as far as he's concerned, double mastectomy is the only way to go, and that kind of agrees with what I already know, that I would probably have to get that double mastectomy because I can't do periareolar or key, like, okay, so periareolar is when they go in through the nipple, extract the breast tissue with liposuction, and then close it up through the nipple, and it really doesn't leave you with any scars. But that's a kind of surgery that has 2 disadvantages. The first one is that depending on the size of your breast, and if you have any loose skin that's going to be left once you suction out all the content of the breast, you're going to be left with that skin. So if your breast is actually a little bit larger, or you have a skin fold, that's not going to be an option. And the second thing is that they don't relocate the nipple. Like, they can resize it a little bit, but you are actually left with pretty much the original nipple that you have. So if you have large breasts or very large nipples, or maybe it's not for you. It's not for me, because I do have a skin fold, and I don't really care, because it's fine. There's a lot of double mastectomies out there that actually look really good. So he agreed that it would be a double mastectomy. He informed me that I will probably lose sensation in my nipples, which is fine, whatever. And maybe a little bit loss of cutaneous sensation, like in the skin, in the chest a little bit also, which also I've heard from guys that sometimes they lose sensation a little bit around the scars. I really don't care about that. I'm just fine, it's fine. I do not mind at all. So if I get operated on by him, it can also be in summer. It can be about the 22 of June, but I have to decide really quickly and pay the reservation, which is like 500 euros. So this really has to be like I'm doing it, you know? So that's that. And I asked very specifically about the shape of the scars, and I've been told that Dr. Moscatelli, he can, going into the surgery, he takes note of your preference, like if your preference is to have straighter scars, but it's really according to the structure of your chest and your breast that he's going to be able during the surgery, throughout the surgery, to know for sure if he can give you straight scars or if they're going to have to curve a little bit. So what I did is I spoke to him. I told him, look, I really prefer straight scars, and he says, okay, I'll do my best. And it's kind of like, ooh, that's a tough call, you know, because I've been talking to Tintore and he was like, yeah, no problem, I'll give you straight scars. And I'm like, now I'm kind of like divided, like, where does the truth lie? Is it true that you can pretty much decide what shape of scars you're going to do? Or is it really that dependent on the shape of the breast? Because is it different surgical techniques? Like, what's going on here? What's this difference between two plastic surgeons who are like pretty much at the same level? How come one of them can tell you, yeah, I'll give you straight scars, and the other one is like, no, I have to go into the surgery and see what I can do for you? So on the one hand, I really like Dr. Moscatelli's response because it sounds very honest, very truthful, you know? It sounds like it's something that he deals with a lot, with trans guys who really want straight scars, and it's probably what he can do, you know? And on the other hand, there's something very reassuring about being told, like, yes, you'll get what you want. Dr. Moscatelli has much more experience, it seems, with this kind of surgery, because he says he does this type of surgery 4 to 5 times a week, and he gets a lot of trans guys coming to him for this, which I actually believe him, because his results, they do seem pretty good. I definitely prefer like his results to all the Israeli surgeons whatsoever. And in terms of nipple placement, he's better in my eyes than Tintoret Brasso. And even like his most miserable results look better than the third guy that I was thinking about, Musolas, Dr. Musolas. Even Moscatelli, even his results that kind of look like a breast shape, they look better than the bad results from Musolas. So we really here between Tintoret Brasso and Moscatelli, and I need to decide, like, for me, for myself, I feel like I need to decide today. You know, I need to know how and when this is going down. Also, like, for the possibility of my mother, like, coming to join me, coming to help me out during my surgery, she needs to know the dates. And so she could get, like, a plane ticket, and I could book the Airbnb and all the rest of it. So, just to give you guys, like, a feel for what's going on, this is what I look like right now. 4 years almost on testosterone, like 3 years and 11 months. So you can see that, like, my fat has really redistributed. It used to be a lot more here, now it's a lot more here. So it's not a huge gut. It's a little bit of a muffin top. I'm good. I got a little bit of muscle on me because I do train. I do martial arts. I do circus arts. I bike quite a lot, and yeah, I try to go to the gym every now and then also, you know, dance a little bit as well. I try to use and enjoy my body any way I can. So that's kind of like what I look like right now. Also, I'm a physical therapist, so I'm going to do the rehabilitation from the surgery. I want to do it with physical therapy. I know not everybody does. I'm probably going to manage my own case, but I do want to be attended by other physical therapists, like at least someone who would be there to, like, guide me through, because I don't want to really be completely responsible for the whole process myself, because it kind of scares me. Okay, so I need to go decide between these two very good surgeons. Actually, they're both very good options, and whatever I do, I'm probably going to be okay, in the end, I'm probably going to get good results. The thing is, with Moscatelli, because he has so much experience, and he's been doing this 5 times a week for the past 5 years. I'm actually leaning towards him right now because Tintore, I know he's a very good plastic surgeon, but he doesn't seem to have that much experience with the double mastectomy. The price, it's nicer to be able to pay less, but it's not a deciding factor for me. I would really go by results before money, because fuck it, like, money you could work and save and repay and take a loan and whatever. And and when it comes to results, it's like you either get it right the first time, or you're into like revisions and really crappy like procedures, and I don't want to do that. I just want to have like this one procedure and be over with it. So there's that. In terms of nipple placement, like I said, Moschetti, I like it better. He doesn't do very small nipples, like it's not cookie cutters, you know? But they do come out like realistically masculine. In terms of scarring, I have seen him done like